अगर आपके पास कोई सैम्पल आता है जिसमें पस जैसा वो दिख रहा है बट कंफर्म नहीं है, तो डॉक्टर ने लिख के दिया है प्लस एंड फ्लूइड, सो व्हाट कैन बी डन? What are the tests which can be done on this fluid? This fluid is called as purulent fluid. हम फ्लूइड को पस नहीं लिखते हैं, हम उसको पुरुलेंट फ्लूइड लिखते हैं, मेडिकल टर्म। इंडिया में अगर हमारे पास पस आता है, सबसे पहले तो आपको ट्यूबरक्लोसिस सोचना है। क्वेरी ट्यूबरक्लोसिस, क्वेरी इन्फेक्शन, query malignancy, also called as cancer in common man's language. All right, so if this is mixed with blood, query trauma. Now what are the tests? Straight go to the test. What are the tests which we will conduct on this pus or purulent culture, and let's find out what will happen out of those tests. First should be TLC and DLC. WBC count, total leukocyte count, and what kind of WBC. Very important. First step. Second step, do gram staining to see if there is any bacterial role. If there is any bacterial etiology to it, gram positive or negative. Now, after gram staining, pus culture and sensitivity to detect the antibiotics. Now, with this kind of pus, definitely go for AFB stain for tuberculosis. But these days, it's not just AFB stain. Now we also go for TB PCR and gene expert, also called as CB-NAT. So go for that as well. So for TB we did AFB plus gene expert. For infection we did gram plus pus culture. Now for malignancy, go for cytology examination. In cytology, we can detect if there are atypical cells, so look for atypical cells microscopically. Infection, pus culture and gram stain, AFB plus gene expert for TB. TLC, DLC in all the cases, and these are the tests. So this is how we go for investigations when we receive pus or purulent fluid.